Okay, let's talk about medical emergencies. Knowing how to respond in an effective way, well, it's critical. Having and knowing how to use an automated external defibrillator or AED is crucial for our safety. Gail Gould, Houston's CPR and Safety Lady, joins us now with how to properly use an AED. Gail, thank you so much for your time this morning. Good morning to you.
Good morning, Zach. Thank you so much for having me here this morning.
Before we get to that, I want to ask you, how do we know our AED in our environment, our place of work, our school is working properly?
Well, the first thing you want to do is turn it on, press the power button, and it should come on and tell you battery operating okay. It should add the power should come on, and you want to make certain that the AED has pads that are not expired. You want to make certain there's a pair of medical grade scissors, because anytime you use an AED, Zach, you have to cut the person's shirt, cut the woman's bra. You want to make certain there's a razor, because if the man's chest is gorilla hairy, you'll need to shave it in order to get contact. So there's just a few things that you want to check. They're very, very easy to use, but Texas schools are required to have AEDs. They're required to have people trained, staff trained to use the AED. They're required to have an action plan to use the AED. And finally, they need to check it once a month to make certain that the battery's not dead, that the pads aren't expired.
Yeah, all good information. Now that we know our device is working properly, Gail, how do we effectively use an AED?
That's a good question. Well, let me back up and say here, Zach, that the majority of people, teenagers and older, will need CPR in conjunction with the AED in order to stay alive. CPR is meant to keep the heart, brain, and lungs alive until the device that can restart the heart, the AED, the automated external defibrillator arrives. So, you'll give the person CPR till the AED arrives. And then once the AED arrives, the first step is to turn the power button on. And then you want to cut the clothes, cut the bra, possibly shave the man's chest, attach the pads, and then it will tell you what to do. All you have to figure out is who needs an AED attached to them. Who needs an AED attached to them? Anyone in cardiac arrest, meaning anyone who's unconscious and not breathing. And people often think, Zach, it only happens to old, out-of-shape people. And nothing could be further from the truth, as we saw just last week. And as we saw a year ago with LeBron James, son Bronny James, who suffered a cardiac arrest at the University of Southern California. So it does happen to young people as well. It's just not old, out-of-shape people. It happens too.
Gail, I'm so appreciative of this explanation. You were able to break it down in a way that we were able to follow. I know before the show began, I was talking with our producers about, is an AED something that's supplemental to CPR? And you explained it beautifully on how CPR comes first, and that's only until the AED arrives.
Yes, and people have said to me that they've said, well, I thought CPR was meant to restart the heart. CPR is not meant to restart the heart. CPR is meant to keep the heart, brain, and lungs alive until the device that can restart the heart, the AED arrives. So basically, our heart, as you probably know, works on electrical activity. And when your heart goes into one of these abnormal electrical activities, it's not going to pump much blood at all. And the only way to get the heart back into a normal sinus rhythm so it can function normally is to use an AED, an automated external defibrillator. So it is critically important that all schools have AEDs. They have a plan to use it. They have staff trained to use it. They check it once a month to make certain the battery is not dead, the pads aren't expired. I cannot tell you how often I've gone into schools and companies where the battery was dead and the pads were expired. And of course, they were embarrassed because no one had been checking it.
Yeah, not good at all. As we know, every second counts. Gail, talk to us about what an emergency action plan is.
Emergency action plan is kind of like we do in the hospital, a mock code. So just because you have an AED doesn't mean you're going to be able to use it. So they need to practice. What are we going to do if someone loses consciousness, stops breathing? Who are we going to call? Is there an emergency number? Who's going to come with the AED? Does everybody know where the AED is located? How many people know CPR? Unfortunately, here in Texas, by law, only one person in the entire school needs to know CPR. Only one person. It's usually the nurse, the coach, the PE teacher, the athletic trainer. Nowadays, schools have been training more people, but that's law, only one person. So they need to have a plan. Who's going to show up? Who's going to get the AED? Who's going to provide CPR? So they need to rehearse that, prior to a medical event. And, basically they just need to have a meeting and make certain that everybody knows their job.
Yeah.
But really important that everybody knows where the AED is. There was a survey done, I think less than 50% of employees know where the AED was located in their building.
Wow. Wow.
Yeah.
Having a comprehensive conversation and then putting that conversation into a plan is really critical. As always, Gail, thank you so much for your time this morning.
Thank you so much, Zach. I enjoyed seeing you.
We appreciate it.